Hello representatives and leadership from Providence Healthcare Center. My name is Tim Justier and I am presenting a new virtual health platform that will attack many of the problems and craze makers that healthcare organizations today face. The areas I'll be discussing in the next 10 minutes are about the platform that I've put together, including the mission, vision, and simply what we do. It is important to discuss what sets us apart from the competition, the regulations around the changes, how the marketing strategy caters to remote patients, the human resource plan over the first year, as well as the annual budget plan to include the startup costs and financing. All information will be transparent and I will be happy to answer any questions. So, the mission of Stinger is to provide healthcare staff and patients with the best virtual tools to enable healthcare from remote locations. The vision is to have patients without barriers to the healthcare they deserve no matter the distance. We provide user-friendly tools to increase access to care for healthcare organizations by implementing virtual platform. So why is it important for Providence? The platform can increase access to care and improve hospital ratings. The overall hospital rating for Providence is a 2 of 5, and according to the 295 completed surveys in the last year, only 61% of patients were satisfied with the access to care, while 53% of patients thought the hospital was basically just too noisy. So with statistics like these ones mentioned, people may want and feel a need to utilize virtual medicine with your providers. Regulations and ethics. The privacy and security of patients' medical and other health information are protected by the Health Insurance Portability and Accountability Act, and with the privacy and security rules, when it's sent or obtained by a given medical application, protected health information, which includes name, address, age, and any health personal details like social, all that stuff. Information gets sent over needs to be protected from those that don't need to know. All right. According to ethics, it is the duty of our security team to make sure that the data is securely encrypted and transferred to just the patient or where the patient wants it to be submitted to, so faxed to. If any unauthorized disclosure does happen, then it is the healthcare organization's responsibility to notify the patient. And to regulate the way organizations manage the security of the changes, there are steps that should be taken. So identify the privacy and security measures that are part of the organization's mobile device risk management strategy. To protect patient information, the company should create, document, and put into practice mobile device policies. Conduct training on mobile device privacy and security for professionals and service providers. All right. Virtual care can increase access to health care services, especially for people who live in distant areas or have medical issues that make it risky or difficult to visit a doctor in person. The use of virtual walk-in clinic visits where patients register into an app and are paired with a licensed physician has also been chosen by other healthcare organizations. So we're kind of behind the curve on that one. How great would it be though to be able to log into an app and see a provider when you feel ill and you don't want to leave the house? Part of the platform will also be online checking in, so you can see like the wait times in the ER as well as you can check into the ER so you have a spot in line so you have to wait in the waiting area. And by not sitting in the waiting room, it frees up space, prevents airborne illnesses from traveling around to more patients, and the virtual appointments will also decrease the amount of time staff has to disinfect the rooms and will save materials. So what is the Stinger platform? Well, due to treatment delays, unmet health needs, aggravated diseases and complications, patients with poor access to health experiences, worse results, and incur actually more healthcare costs to the healthcare system. With a simple login with a mobile device like a tablet or a smartphone, a patient can check in online to a provider or nurse advice line. The patient will be notified in a queue for when the provider is ready to see them, and then the appointment can begin. The provider can then even schedule any follow-up in-person visits or put in for labs or radiation stuff. All right, patients may just need some health advice, so let's give them peace of mind. I mean, imagine a busy person who just wants to rest and doesn't have time to wait in an emergency department. Imagine that's the first time you get the flu. You don't want to leave the house or let alone the toilet. So it'd be amazing just to be able to go on an app, talk to a provider, get a sick note, and boom. All right, get seen the way you want. Strategies to promote patient engagement and shared decision-making and communication regarding wait times between patients and care providers can be crucial to improved emergency department patient experiences and person-centered practice. So reducing the amount of time patients must wait in the lobby of the ER will not only improve the hospital rating, but will make the patients and the staff a lot more happy. Records at your fingertips. Mobile health applications are software programs that are related to the health knowledge and used by healthcare professionals and patients to enhance health. The applications turn mobile platform into a regulated medical device. So what if you are on vacation and need to get seen by a provider at another healthcare organization? To reduce time, you can be able to just go right on the app and be able to just have the information faxed over from the app to the doctor's office that you're currently sitting at, instead of having to contact your previous provider or hospital and have them fax over the information. So it's going to actually spend less organizational time doing all that, and have the patient be able to just do it themselves. So we're basically teaching them how to fish. All right. Human resource plan through the first year. The process is simple, with how the organization can leverage the current positions and implement the changes that the platform will make. My team will implement the system, train the IT department, and give some advice on best practices. The positions the healthcare organization may want to consider in rotation of virtual providers, virtual nurses, and admin staff that can monitor the messaging online, as well as the emergency department queue. All right, the one-year budget plan, the not fun part. It will cost roughly $34,000 to purchase the basic video conferencing system that complies with security regulations and covers multi-specialty treatment. For the minimal cost of $100 per month, as per the contract, we will troubleshoot any problems the company may encounter. That's actually lower than our competitors. The budget can be negotiated since there are different levels of products and features the organization may want. The initial setup will cover the equipment, installation, and training for the IT department of the organization. All right, the areas I discussed in the last, well, more like 7 minutes, were about the platform that I've put together, including the mission, vision, and what Stinger has to offer. It's important to discuss what sets us apart from the competition, the regulations around the changes, how the key marketing strategy caters to remote patients, the human resource plan over the first year, as well as the annual budget plan to include the startup costs and financing. All information will be transparent, as I said, and I'm happy to answer any questions of concern. All right. And these are my references from research I completed for the presentation. Please address any questions. If you don't have information on me, I'll make sure I get the information and get it back to you. Thank you all.